for the opportunity to discuss with you several extremely important topics in the treatment of heart failure with reduced ejection fraction. And let me stress once again that I have a long-standing cooperation with Pakistani Cardiac Society and Pakistani Society of Heart Failure, and I would like to thank very much Professor Shabas Kurteshi for inviting me. We know that heart failure patient journey is a difficult one. We would like with our drug to make that easy and smooth. However, the reality is one, and our wishes are maybe different, but not always became the reality. As you can see, the heart failure patient journey may come from the smooth and uneventful course to the decompensation and even arrhythmic event or other forms of cardiovascular catastrophes. We are trying to make this journey smooth in applying the medical treatment. And as you can see, the European and American guidelines are in complete agreement that the treatment should be based on four pillars. The loop diuretic should be used for fluid retention, and holistic treatment of heart failure should be something which we need to understand. We are facing these days the different treatment options in heart failure, but the only one who I'm going to discuss in this lecture is going to be the medical treatment, which gave us the hard time because starting from the blocking neurohumoral activation, which reduce symptoms, heart failure, hospitalization, and cardiovascular mortality, we are witnessing these days some new drugs and some new strategies. However, having in mind all that and extremely nice and successful treatment of heart failure, we may say that all over the world the incidence and prevalence of heart failure is increasing. So, what is the reason for that? And that is the part of the title of my talk, Light and Shadow, giving us the idea that we could not prevent everything which is going on during the course of heart failure. It is important to understand that four drugs we are giving to our patient will prevent and will stop some of the important neurohumoral activation. But this is associated with the polypharmacy in this patient, and this is per se a big clinical problem which we need to address. In addition to this, it is extremely important to understand that complexity of patient with heart failure comes from the different underlying cardiovascular pathologies involving coronary artery disease, valvular heart disease, and right ventricular dysfunction. Also, we are witnessing the rise of the specific etiologies like amyloidosis, storage disorders, hemochromatosis, and hypertrophic cardiomyopathy, which all can give us the idea that we can treat this patient etiologically, and this is the best way for the treatment. However, what is complicated both our diagnosis and our treatment are the presence of multimorbidity in heart failure associated with chronic kidney disease, chronic obstructive pulmonary disease, anemia, and then several very important and very big comorbidities like obesity and type 2 diabetes. In addition to that, we need to understand that heart failure patients are prone to develop not only cognitive impairment, to some extent also dementia, but also important point of frailty and sarcopenia, which may shorten then their life and may lead to the very early demise of those patients. Important and excellent concept is a patient profiling, and this is something which give us the idea that we need to tailor our medical treatment to the specific clinical profile. In one side, hemodynamic one, blood pressure, heart rate, and the presence of arterial fibrillation. And on the other side, humoral, like CKD electrolyte abnormalities, and also taking care about residual congestion. By saying that, we may recommend to define the 9 clinical profiles in whom we can clearly see that the different drug should be used in order to achieve the maximal efficacy and minimal side effects. All this is giving us again the right to say that treatment of heart failure is an art and that all of us need to understand that having the violin and stick is important, but also playing the right melody at the right time is essential. These strategies are the part of approaching heart failure patient in all of these clinical scenarios. And what we need to understand is that the first drug usually given should be SGLT2 inhibitors. In order to blockade of the neurohumoral system, beta blocker can be given, then AC inhibitors or ARNI, MRI, and finally diuretic. But what order and what dosage of drug should be given, it's always the question of skills and clinical assessment. We understand now that the best treatment of heart failure is etiological treatment, and we may say that coronary artery disease is the most frequent cause of heart failure, but also some of excellent valvular heart disease entities are defined and can be treated very successfully, like aortic valve problems with TAVI, then mitral clip, functional mitral regurgitation, and even tricuspidal regurgitation recently. As I pointed out, we are now able to recognize several systemic etiologies of heart failure, giving rise to different new drugs which can be used in those conditions. Therefore, the comorbidities are complicated, the clinical course of heart failure, and the essential thing is to see what is the comorbidity among many comorbidities heart failure patient may have, which is going to influence the course of the disease to higher extent and address this comorbidity with a particular treatment. That comes on the first time with the type 2 diabetes, which is extremely common. So we may say, in one side, that 40% of diabetics have known or unknown heart failure. And also, what is important, that vice versa can be also applied. The patient with heart failure has in more than 30 to 40% the glycoregulation. Therefore, it is important to understand that we have new class of drug in the treatment of this patient, and this is SGLT2 inhibitors, which can be given independently of glucose, of other, let's say, glucose lowering medication. Another important comorbidity is CKD, and as you can see, it is important to define early risk factors leading to the early appearance of the CKD, treat blood pressure properly, treat diabetes and LDL if it's high. ACE inhibitors are very important in the treatment of this kind of comorbidity. The effect on kidney event is good, but it's not comparable with what we have with SGLT2 inhibitors, which is improving the cardiovascular outcomes and also decreasing CKD progression. Finerenone is the new drug which should be given to the patient with type 2 diabetes, which is very positively affecting the CKD progression. So, CKD in general is very much associated with the progression of heart failure and should be treated very early and very intensively. Iron deficiency and anemia, it's on the table for the last 5 years, and iron supplementation definitely is effective in reducing cardiovascular and heart failure hospitalization, but it seems that it does not influence the mortality to the higher extent. All these drugs, ACE inhibitors, beta blockers, MRI, and ARNI, should be given simultaneously in our heart failure patient with up titration in order to decrease the mortality of those patients. The multinational observational study from US, UK, and Sweden are giving us the idea how important may be the simultaneous heart failure drug up titration in our HFrEF patient. In addition to that, in 2023 focus guidelines, the intensive strategy of initiation and rapid up titration gave the highest recommendation with the class of evidence 1 and level of evidence B. Once again, what needs to be underlined is that SGLT2 inhibitors, both EMPA and DAPA, should be given to this patient very early. As co-editor of European Heart Journal, I have the pleasure to draw your attention on one of the important paper which is dealing with accelerated and personalized therapy for heart failure with reduced ejection fraction, saying that this approach can prevent 47 heart failure hospitalization in 1,000 treated HFrEF patient during the first 12 months. So all these new strategies is practically already approved and already checked in the real life and therefore needs to be applied. What are the shadows? What are the shadows? The shadows are the different side effect of our treatment. This is something which we need to underline, and this is a hypotension, electrolyte disbalance, and worsening heart failure. And I'm going to discuss them in short. It is important that hypotension may be the key feature of advanced heart failure, and then the treatment should be modified accordingly. In other patient, if the patient is asymptomatic, we just continue with the drug we are giving. But if the patient is symptomatic, then we need to be very careful what drug we are using, SGLT2 inhibitors, and MRIs, which has a neutral effect on the blood pressure. Then carefully use beta blockers to avoid an unnecessary hypotensive effect of these drugs. That was the topic of our position paper, Heart Failure Association of the ESC, in whom we discuss the best strategies how we can avoid the low blood pressure and still continue with the optimal treatment of those patients. Among the electrolyte disorder, hyperkalemia and hyponatremia are the most important. And once again, SGLT2 inhibitors have the neutral effect on these two conditions. It is important to underline that SGLT2 inhibitors can be used to facilitate the use of MRI, and in Emperor Reduce, we were able to prove that MRI antagonists are giving with more freedom and with less discontinuation if they are giving simultaneously with empagliflozin. So this is a very important clinical fact which we need to take into account. Obviously, we have Patiomer, which was tested in a diamond trial among more than 1,000 patients. And it is clear cut that this drug can reduce the risk of hyperkalemia, MRI discontinuation, and that the clinical effects are very good. However, the drug did not receive or overall clinical acceptance due to the various reasons. If we look at the renal function, we can say that in patients with diabetes and CKD, the drug of choice may be finerenone, which was tested in the Figaro DKD trial, which reduced the composite of death, non-fatal MI, non-fatal stroke, but also the hospitalization of heart failure. So this is one of the drug which we may take into account when treating the shadows in the patient with heart failure. Uh, you all are familiar with the strong HF, and what this is underlining is a clinical fact that high intensity treatment was much more successful in reducing 100-day readmission for heart failure and all cause death. But also, this high intensity care was essential in reducing all cause death in those patients. Uh, Going to the SGLT2 inhibitors, we may say that there are several important meta-analyses showing that this drug should be used in all patients with left ventricular ejection fraction less than 25 to less than
Peter,
65,
I'm sorry.
and they can be also used in the decongestion in acute heart failure. So
Peter,
this
I'm sorry
is
to interrupt.
one of the different drugs which we may recommend in patient with acute heart failure upon, let's say, stabilization. From the European Heart Journal, the great debate about SGLT2 inhibitors as a first line treatment in heart failure. And I can tell you in two words, yes, these drugs are now the first line treatment in heart failure. And this great debate give an excellent insight that they are the proofs and the conditions for the treatment of SGLT2 inhibitors very early in the treatment of heart failure with reduced ejection fraction. However, ladies and gentlemen, having in mind the part of world we are living in, I would like to draw your attention on the report HF study when only 37 of REF have patient were discharged with at least three important heart failure medication. That give us the insight that all this is extremely important at low and mid income countries, and both are our country belong to that group, should be very
Peter,
much
can I interrupt you?
taking. Yes.
Uh,
Yes.
since we are running short of time, can you come to your concluding slide?
Okay, no problem. This is my concluding slide. There is an excellent ESC textbook on heart failure, which can give you the idea about everything which is important in heart failure, and therefore it is essential for the young physician and your fellows to get this publication in order to be efficient in heart failure. Thank you very much for your attention.